Bonjour à tous.
Hello, everyone. I'm very happy to be here for this 2018 edition of the Agence Day. It's also a very great way of seeing that this observatory is growing. We are partners. We have been partners, so I would really congratulate and I would like to thank the Piafab Foundation just to give me the floor to introduce that day. And so quickly, I'm going to go through what I feel and how I feel digital health is important. And as a supporter, we are here to, in fact, add our development to our digital e-health solutions because we're very much convinced of the potential and the benefits that these digital tools bring to the health systems throughout the world, but even more in Africa or in Asia where the challenges are huge.
Donc, je vais vous dire évidemment 2 mots sur l'AFD.
So, very quickly, for those who do not know us, the AFD is a player in the health system. We work not only in energy, but also health, water treatments. The idea is to support a transition towards a more sustainable world, a fair world. So we have therefore developed a worldwide network. The idea is to support our partners, whether they are private partners or public partners. The idea is to help them build their projects. Today we are present in 108 countries with several agencies throughout the world, and you can see the breakdown here. We are in Europe, even if we don't see this on the map. We work in the Balkan, and we will support about 3,600 projects. So you can see most of our funds are dedicated to Africa, but we still have 20% of our funds that will be given to Asia. So in the recent years, you know that digital has grown even more in the AFD strategy and how we select our actions. So the idea is to become, in the long run, digital funder, so using all the potentials for our own actions, but also a funder to fund the innovation and digital innovation through the different countries where we operate. So in addition to the digital projects that we support and structures, the idea is to, in fact, disseminate a digital culture in all these sectors and really use all these tools to boost the efficacy. Now, in the health sector, because this is the topic of our day, clearly we can say that the digital will open new doors, new opportunities, especially given the various challenges that health systems encounter. We can think of HR or medical breakdown with number of doctors or the patient's journey, and then the cost of the healthcare, which is a huge challenge, and I think that all the countries have to take up this challenge, especially when they develop their or the health approach. So in front of that, we believe that digital will offer great opportunities to really steer the decisions and also improve the prevention and also the service offering, giving access to specialized resources or improving access to treatment. Today, the ADF in the digital era, even if it's still small, but we are still supporting 24 countries throughout the world in different scope of activities. I'm thinking of the hospital IT, sanitary or epidemiological monitoring or e-health solutions, and in total is 55 million euros. So we have built our strategy revolving around digital on 2 pillars. The first one supporting innovation, and the second is supporting these innovation in the health strategy, public health strategy. So the first pillar, I think, the first example is a best example. It's the partnership that we have established with the Pierre Fabre Foundation. And for us, it really is a strategic partnership. With that, we can identify the best practices because, again, we track the various actions. We have a deep monitoring of all the actions. So every year we identify the gold nuggets in terms of innovation. And it's also a great way of capitalizing on these innovations to learn even more, building a better knowledge of the sector, and therefore to better support our partners on different areas. So we have also launched a bid among NGOs. The theme is mother and child health. So that means that we have supported 3 digital projects in Mali, Senegal, and Burkina Faso. We use mobile technologies. This is in order to improve. So either we create a patient's record in community or even creating applications to educate the mothers, the children, or improving the follow-up, medical follow-up of these young children. And these projects have enabled us to improve the health of 90,000 mothers and children in these 3 countries. So we equip, we train 190 caregivers. So I'm going to quickly present the projects in pictures. This is called Mobisam. Your child is 2 months, so you've got to think about the vaccine and take the time to bring him to a medical center to weigh the child. So that was a little example for these projects. This is for the bid that we have launched on the NGOs. Now, just to quickly conclude on the various actions that we have supported also, I will talk about the Digital African Contest. This is a contest that was launched by the AFD with bidding France. The idea is to select the African innovators in the digital world, including in the health area. Now, in addition to this contest, this platform, Digital Africa, will become probably a pool for our resources, especially in Africa Digital. So we hope that we're going to develop more synergies with the work of the observatory. So obviously, if it's always essential to support innovation and also create a facilitating, so because we need also to evolve as quickly as the technological evolution, the idea is to meet the needs of the populations. We clearly know that these innovations will improve the health system, and therefore you have to make sure that they have to be integrated in the public health policies. The idea is to clearly boost the efficacy, and this is what we try to do at the AFD. So can I just give you 2 examples of 2 projects that we support?
Alors,
The first one.
c'est
The first one is a cooperation
qui a été
technical
lancé,
program
entre la France
that
et la
was launched
Tunisie,
between
dans
France
lequel on
and
accompagne le
Tunisia,
ministère de la
and
Santé
we also
tunisien
support
dans
the
la
Health
définition de sa
Ministry
stratégie
when they
e-santé et de
define
son
their
plan
health
d'action
strategy and
prioritaire
also
dans le
their
numérique en
priority
santé.
plan of
Dans lequel on
actions
a
in
pu
digital.
mobiliser donc
So we
des
have been able
expertises de
to
différents
mobilize
partenaires français,
experts from different French
donc la e-santé
partners,
sur
so
l'interopérabilité, l'assistance publique des hôpitaux de Paris sur
interoperability,
les systèmes d'information hospitaliers,
the
pour réellement
information systems
accompagner
of the
le
hospitals.
ministère
Just
de
to
la
give you
Santé
a
dans la
couple of
conception de
examples,
son
the
plan
idea is to
numérique.
accompany the Health
Et
Ministry when they
cette
devise
coopération
their
technique
plan.
a
And
débouché
this
donc sur la
technical
construction d'un
cooperation
plan
has
d'action
given rise
prioritaire
a
autour de
priority
deux
plan of
grands
action around
axes.
two
Le premier qui est la
main areas.
numérisation
The
des
first
hôpitaux
one
du
is
pays, donc
the
30%
digitalization
de
of
la
the
capacité
hospital
en lit du
countries.
pays qui vont être
So the
numérisés.
capacity of beds
Donc
will
12
become
hôpitaux
more digital.
dans lesquels on va déployer
12
des applications
hospitals,
qui
we're going to
sont
deploy
le dossier
applications
patient,
there,
les
which is the
archives
medical
numériques,
record,
des
the
applications
digital
pour améliorer
archives,
la gestion
the
des stocks de
applications to
médicaments ou
improve the
numériser les fichiers
medication
radio.
stock,
Mais également, et
or
c'est ce
the
que je voulais
X-rays.
surtout souligner dans ce programme,
But also, and this is what I
une
wanted to say with this
coopération qui a
program,
permis au
this
ministère de la
cooperation,
Santé
which has
d'identifier, de lancer un appel à initiative sur
given
son
the
territoire pour identifier
possibility
vraiment des
to the
initiatives
ministry
de
to really
e-santé
launch
portées par les
a
établissements
call
sanitaires
for
du pays,
projects
et donc
in the
réellement de
country.
pouvoir
So truly,
accompagner
the
ces
idea is to
initiatives à
support
travers
these
des financements
actions
du
through the
ministère. Et donc 5
funding of the
initiatives ont
ministry.
été
So 5
sélectionnées dans le
initiatives have
domaine
been
donc
selected
obstétrique,
in
périnatal,
the
cardiologie et
gynecology,
urgence
cardiology,
pour vraiment
emergency
développer
area. So the
des
idea is
initiatives
to
sur les
really
territoires qui sont peu dotés en
support and
ressources
develop
spécialisées, donc les
these
territoires du centre
initiatives
essentiellement du pays,
in the center
de façon à
territories of the
réduire les
countries.
inégalités
The
territoriales en
idea
santé.
is
Et on
to
voit là dans
reduce
ce
the gaps
programme
in
que vraiment
inequality. So we can see through
l'innovation
this
qui a
program
émergé à
that
travers
the
cet appel à
innovation
initiative
which has
nationale
emerged thanks to this
intègre
national
la politique
initiative
territoriale
will
de santé
integrate
du pays
the
aujourd'hui.
health
Un autre
policy
exemple de
today.
ça que je voulais
Another
souligner, c'est
example
au
of this
Kenya,
project is in
où
Kenya,
nous apprêtons à
where
soutenir
we
l'entreprise
are going
sociale
to
Carpe,
support
qui a développé à travers des solutions de mobile banking un système pour améliorer la
So
gestion
this
de
is a
l'assurance maladie.
system to
Donc, comme
better
vous voyez sur
manage
ce
the
petit
national
schéma,
health
il y a une première
system.
solution
So you can
mobile,
see here on this
MTBA, qui
slide, you
permet de
have
faciliter la
NTBA, which
collecte
is a
des
mobile
primes assurantielles.
solution that is going to facilitate
Et
the
une deuxième
collect.
solution qui est bien connue,
And
qui
a
est
second
M-Pesa
solution is
de
the
mobile banking, qui
M-Pesa,
permet de
it's mobile
faciliter
banking.
le
The
paiement et
idea
le
is
remboursement
to
des prestataires de
facilitate the
santé.
reimbursement of
Ensuite, l'entreprise sociale
healthcare.
Carpe a aussi
And
développé un
then
système d'accréditation
Carpe
qualité pour les structures dans
has
lesquelles elle met en
also
place ce dispositif.
created
Et donc on le comprend bien, ce système
another
d'utilisation des
system,
technologies
so we
mobiles
better
permet réellement de
understand the
réduire le
system
temps
of
et
these
le
mobiles.
coût
The idea is
de
to
l'ensemble de ces
reduce the
transactions.
time and also the
Et
cost
on
of all
commence à
these
soutenir cette entreprise
transactions. And
sociale
so
au
we
moment
have
où
started
elle va
supporting
déployer sa
this
solution
company
au service
when
de
they're
l'Agence
going to
nationale d'assurance
deploy
maladie
the
kenyane,
solution
et donc
within
essayer de
the
passer à l'échelle
national health system in
de
Kenya.
renforcer un
So
petit peu
really
ces
supporting
capacités
and
pour pouvoir
also
couvrir
strengthening the
l'ensemble de
capacity.
la
The idea is
population
to
qui est
cover
couverte par
all of
l'Agence
the
nationale
population which is
d'assurance maladie.
covered by the
Voilà, je pense
national
que c'est un
health
bon
system.
exemple
Anyhow,
aussi d'une
that's
innovation
another
qui a démarré sur un
example
mode
of
pilote dans le secteur privé
innovation. It
et qui
started
aujourd'hui
in the
se met au
private
service d'une
sector
politique
in a
publique pour améliorer la
pilot mode,
couverture du
and
risque de
today
maladie pour
it
l'ensemble
is
de la
available for
population.
the most of the population.
Voilà juste quelques exemples, je ne vais
Okay,
pas
just
être
these
plus
two
long, je vais vous laisser
examples.
rentrer
I
dans le vif du sujet et
won't go
découvrir
further because
les
I know you
intervenants de la
have a very
journée. Je vous
busy
remercie.
schedule today. Thank you.
Merci Anne Roos Weil de cette
Thank you,
présentation. Je
Anne
l'ai entendu, les mots
Roos
de
Weil, for this presentation.